the NICU is only the beginning. It is chapter one. So, how you show up for your baby in these first days or weeks is important, but how you show up for yourself is equally as important. And you have thousands of more nights together as a parent to bond and connect and advocate and do all the beautiful things that are parenting.
Hello and welcome back to another episode of the Birth Lounge podcast. Welcome back, you guys. We are wrapping up the last week of NICU Awareness Month. But before we do that, I want to share a little personal story. So I was just waking up last week, and one of my really good friends who's also pregnant, it's been so much fun being pregnant with her, she texts me and she goes, oh shit, I am 34 weeks and I realize I have nothing to ask my provider. I really don't know what I should be talking to them about in today's appointment. And I quickly texted her back and said, download the Birth Lounge app and go to 34 weeks and it will tell you what is going on with your baby and what you should be asking your provider. Then she texted me and was like, when is my GBS test? And I said, it's probably in the next couple of weeks. And she said, what question should I ask about that? And I said, download the Birth Lounge app, go to GBS, and it will give you all of the questions that you should ask. And then she said, should I tell them about the Braxton Hicks that I've been having? And I said, yes. And she said, what else should I be asking? And I said, go download the Birth Lounge app, girlfriend, and it will give you all of the questions that you need to ask. So my advice to you is, if you're sitting in your prenatal appointments right outside in the lobby and you're thinking to yourself, what am I going to talk about today? Am I just going to walk in there and let them fill the 5 to 8 minutes I have with them with the things that they want to talk about and walk out feeling like, what was the point of that? Then let me stop you right in your tracks. I want to give you some control back in that conversation. I want to equip you for the things that you can truly ask your provider to make sure that not only are you getting evidence-based care, but are you truly matched with the right provider? Are you having the discussions that you need to be having leading up to your birth? Are you asking all of the questions about what to expect in labor from your hospital that are based on their particular protocols? Because if you didn't know, every hospital kind of has their own protocols and policies. So if you're at hospital A, they're going to have certain policies and protocols. Hospital B will be a little different, and then hospital C might be drastically different from even those two hospitals. And so I always think it's a great idea to know exactly what you're walking into when you get into the hospital having your baby. But these are not discussions that you want to do while you're in labor. These are the discussions you want to have leading up to your labor in those weeks before you go into labor. The Birth Lounge app will not only teach you what is going on with your baby and your body every single week, but it will also give you evidence-based information and the questions that you should ask about all the topics that you need to be discussing with your provider before you go in to have your baby. So go to your respective app store, whether that's Android or iPhone, type in the Birth Lounge app, and you'll see it right there. Download it to your phone. Start to go through it as you are in bed and having that nudge to scroll. So instead of scrolling social media, that typically gives us anxiety, you can instead scroll in the Birth Lounge app. That will not give you anxiety. It will give you evidence-based information. It will give you confidence. It will help you be informed. And, dare I say, it might even make you excited to have your baby. I want you to have the absolute best birth possible, and I'm not going to toot my own horn, but what I will say is I know how to get you there. I've been doing this for 10 years. I have seen thousands of births, and I have seen so many women before you have their dream birth. And I'm following this same exact approach in my own pregnancy, and it has been so joyous. I'm genuinely so stoked to give birth. And I want to share that with you because I want you to feel the same joyous feelings. Head to your app store and download the Birth Lounge app today. See you there. All right, you guys, we're wrapping up NICU Awareness Month, which I know is kind of funky to think about it being a joyous topic. And you know what? It's not. Being in the NICU is really, really hard and heavy and filled with a lot of emotions and actually a lot of uncertainty and a lot of unknowns and a lot of questions and a lot of, am I doing the right thing? Am I asking enough? Am I doing enough? And you are. You're doing plenty. But what you may not be doing is asking the right questions, and that's okay. You've never been here before. Nobody expects you to know exactly what to do or exactly what questions to ask. And so today, I wanted to talk about that. I wanted to explain exactly what navigating the NICU might look like if that's part of the story, and how you, as the mom, the dad, the family, the parents, even the grandparents, so share this with your own mom and dad, can help be an active participant in that journey. I want you to feel informed and in control of the decisions that are made for your baby in the NICU, which I think for so many parents, that feels weird. You kind of think, well, what do I know? I'm not a NICU nurse. I'm not a doctor. I'm not a neonatologist. How can I be in control of the decisions that are made in the NICU? Am I not just kind of sitting on the sidelines watching what happens to my baby? No, absolutely not. You have so much power in the NICU, and that's exactly what I'm diving in today with my good friend, Mary Farrelly. Mary is a certified NICU nurse, doula, and educator who helps bridge the gap between families and the NICU with evidence-based empowering support. As the founder of the NICU Translator, she creates resources and trainings to help both parents and professionals feel more confident navigating life in and after the NICU. Mary also created this really cool program for doulas to become NICU certified and perinatal professionals to be trauma informed. And she calls this program the NICU Doula Academy. She offers workshops, birth planning tools, and professional education. And honestly, I think what I love most about Mary is how much joy she gets from teaching people about the NICU, which is seemingly such a scary topic. But Mary somehow has a way of making it really, I don't know, just not scary. And I love that she's on a mission to bring more joy and less trauma to the NICU experience, not only for parents, but also for all of our healthcare professionals as well. In today's episode, we're going to talk about how you, as the parents, can build a good working relationship with your NICU team and what are the best ways for you to advocate for your baby's needs, especially if while they're in the NICU is pretty severe and they have maybe a bunch of cords and monitors hooked up to them. We're also going to dive into how can you participate in your baby's care if they are in an isolette, and what kind of signs should you be looking for to see if your baby is comfortable or in distress. Mary's going to explain who all the key members of a NICU team are and who all the various faces that you might meet are, plus the role that they play. And we're going to talk about the importance of skin to skin and how you can be an active participant in your baby's feeding plan, plus what can breastfeeding look like in the NICU. Today's episode is so empowering, and I not only love Mary so much, but I love educating people on their options and their control within the NICU, because what I hear so often from our NICU families is that they feel forgotten. They feel like a piece of maternity care that is just not talked about enough. And so, you know what? Leave it to me. I will talk about it. I'll talk to you. I'll bring you into this circle. And that's exactly what we're doing in today's episode. So, without further ado, Mary, welcome to the show.
Thank you. I'm so excited to be here.
I'm so excited to have you. It is always so special. I'll say this every time. It is so special to have one of my friends on the show and not just a guest. Not that I don't love our guests, but if you're a guest and you're my friend, I'm like, oh, this is the feel of the podcast that I am going for. Because I always say this podcast is just a girl's time. We're just having a girl's night. We're sitting on the couch. Some of us are drinking wine. Some of us are drinking water. Some of us are drinking tea. And we're just chatting. We're chatting about things that other people don't chat about. We're chatting about things that moms and women and family and pregnant people need to know in order to have a good experience as they are building their family. So, thanks so much for being here. I'm so excited for this conversation. And it's NICU Awareness Month, which we say that. Yeah, I know. I just saw your face like, yay. And I say it with such, a happiness. But it's actually a hard month for a lot of people because the NICU is a really intense experience. And unless you are part of that really small subset of the population that have the heads up that you may end up in the NICU. Not only is it intense and sad and scary, but it also has this added level of being really unexpected, which comes along with being unprepared. Because I think so many of us never think about or consider the NICU might be part of our story, even if we have a straightforward pregnancy, a really healthy, normal, quote unquote, regular pregnancy with a straightforward birth. You can still end up in the NICU. It's just honestly statistics. It's just part of the journey that may be part of your experience. So I think I would love to start with some simple stats. How many babies each year end up in the NICU? What are the most common reasons that people end up in the NICU or families find their babies in the NICU? Just help lay kind of the groundwork so that if anyone out there is listening, being like, oh, I don't really need this episode, this isn't for me, I want to reel you back in and say, Mary and I both hope this isn't for you, but should you find yourself in the NICU, I do think it would be really helpful if you had this information, y'all.
Yeah, I think NICU Awareness Month is special because the NICU is so not talked about in the birth and postpartum space. So it can make it feel incredibly intimidating and overwhelming. But I also agree that just knowing a little bit about the NICU as you're preparing for birth or pregnancy or beyond can help you navigate things. So the NICU is way more common than people think it is. The statistic is in the United States, it's 1 in 10 babies born each year will require some time in the NICU, which is over 400,000 babies. So, if you're in a childbirth prep class and you're one of 20 couples, statistically, two of you will have the NICU as part of your story. And so another common myth or misconception is that the NICU is just for preemies and that, they imagine Grey's Anatomy and all the little isolates all lined up and lights flashing and beeping, which is, there's some truth to that. Preemies are the most common reason for a NICU stay. It's about 60-ish% of NICU babies are premature, but that's nearly half of babies that are term that require a NICU stay. So because, when babies are in utero and they're growing and developing, they're basically on cruise control, right? Like the placenta is doing and the maternal blood supply is doing everything for them. They have lungs, but they're not really working. They have a heart, but it's not maintaining blood pressure. They have a tummy, but it's not digesting food. And so when they're born, everything has to just turn on. And the fact that it works, 9 out of 10 babies do not need a NICU stay. So the fact that it works so beautifully so often is, kind of a miracle when you think about it. But some babies just need help transitioning to life in the real world. So the other most common reason for a NICU stay is respiratory distress or having a hard time breathing at birth. The lungs in the utero are literally swimming in water. So they have to come out and turn on, and sometimes babies need a little bit of support transitioning. It could be a couple hours, it could be a few days or weeks even. Other common reasons for babies in the NICU are infection. So sometimes babies can be exposed to different things either in utero while they're developing or during the birth process. And babies, especially preemies, just don't really have a very developed immune system. So something that might be a mild infection in a bigger baby or an adult needs a little bit more monitoring and support in a brand new baby. So they may need to be in the NICU for monitoring. And then other more common reasons are jaundice, hypoglycemia, which is low blood sugar. So those are babies that are born that have a hard time regulating their own blood sugar for a variety of reasons, which we can go into if you want to. And then there's some babies that are born, the few that do know that the NICU might be part of their story would be babies that are diagnosed prenatally, whether on ultrasound or blood work, with some type of a congenital difference or something going on with their body that might require intervention or even surgery after delivery. So those are the few families that might know that the NICU will be part of their story. But for the vast majority of people, it's unexpected and it can happen kind of quickly too, as you alluded to. You can go from having everything be totally fine and normal to, I wake up at 32 weeks and my water broke, and now we're going down that path. Or the baby is born and everything looks great, and now they're starting to grunt and kind of act like they need help breathing. So the NICU is something that most people don't plan for, but is a lot more common than people realize.
Yeah. Oh my gosh. As a doula that has practiced over 10 years, I have seen both, right? I have seen people who have diagnosis. And so then our birth plan actually changes a little bit because we know a NICU stay is likely to come our way. But then I've seen people that had that low risk pregnancy. They had that very low intervention birth. And after birth, baby just struggled a little bit to transition. And so they did need a brief stay in the NICU. And I think that is something that a lot of people don't realize. A lot of people think that if you're in the NICU, I think they envision this really long, tough road. But you might really just have a couple of hours in the NICU where you're not even getting so much treatment as you are, your baby's just being monitored.
Yeah, it really varies. Babies, the most, I guess the shortest length of stay typically is about 4 hours because I want to make sure that the baby is completely transitioned and safe to go off of monitoring support and go, back to being a regular baby all bundled up. But it can range from four hours up to, I've celebrated first birthdays in the NICU. So depending on what's going on with the baby, the journey can look very different. But what it remains the same is those early hours of unknowns, sometimes overwhelm and separation as well. So that is the common thread, whether you're in the NICU for 4 hours or 4 days, 4 weeks, 4 months, that those early hours are different for families that experience the NICU. And
Yeah.
it can just kind of shift how their early hours and days are together. Doesn't mean it's necessarily bad. And there are ways that you can step into that space and still be a empowered and informed parent, but it is different.
Okay, so let's talk about that overwhelm. I think one of the biggest overwhelms that people are unprepared for is the visual of the NICU. It can be a lot. It feels, because it is, much more medically intensive than just a labor and delivery room or a postpartum room. So, for someone who has never seen a NICU unit, who has never been in the NICU, and maybe they're even having their first baby and they're out there listening, could you give us a rundown of when you walk into the NICU? What are we going to see? What are we going to smell? Who's going to be there? What kind of equipment is going to be present to kind of set the stage of here's what you're walking into and here's how you can kind of prepare yourself?
Sure. Yeah, the NICU is its own world. Even if you are a healthcare professional and you've worked with adults for your whole life, you walk into the NICU and it's very unique space. So the first thing that you're going to be asked to do is to wash your hands, basically like you're a surgeon going into surgery. So you're going to be scrubbing up to your elbows, making sure that your hands are super, super clean because all the babies in the space are going to be at high risk of infection. So that's the first thing that you're going to experience is walking in, or if you're post-delivery, you might have a wheelchair or even a stretcher, coming in and washing your hands. Then in the NICU itself, babies right after delivery in those first few hours are usually going to be either on what's called a radiant warmer, which is also often in labor and delivery. It's that kind of table with a heat lamp on top. And those are for the bigger babies, and that allows us to observe them without having to dress them. So they'll still be in a diaper, but they can still stay warm from the heat above, and it kind of reads the baby's temperature and it adjusts accordingly. Smaller babies will go in what's called an isolette, or an incubator is another word for that, which is kind of a plastic four-walled box essentially that allows the baby to be maintained in a very temperature controlled environment that also decreases the risk of germ exposure, and it controls sound and light because preemies are still, their body is still expecting to be in a body where it is dark and they can hear sound but it's muffled. So the incubator isolate is designed to kind of mimic that womb-like environment. So those are two spaces that your babies will be in. Then all babies from the time they're admitted to the NICU until the day of discharge will have some different stickers on them that are monitoring their heart rate, their respiratory rate, and their oxygen level. Some babies will also have different IVs in. Sometimes you might see lines in their belly button. Those are called umbilical lines. Babies that are freshly born have these beautiful blood vessels that are just readily available, so they might not even need an IV. Some babies do. And then there's always going to be lots of alarms in the NICU, and they all sound like the sky is falling and it's an emergency. Whoever designed these alarms, they didn't do a great job of making them sound like a good hierarchy. But there's a lot of weird noises happening in the NICU, and often, depending on what type of unit you're in, a lot of NICUs are still very open bay or pod style, so you might be very near other babies and families. Some NICUs are private room also, so that's the trend is more towards private room, but a lot of NICUs are still open bay. So you might hear other babies crying, you might be near other families or see other things going on, which can be a little bit overwhelming sometimes to be around everybody else's experiences too. And then likely the first person you're going to meet is your NICU nurse. The nurses work extremely closely with babies. Most NICU nurses will have one, two, or three patients. Some NICUs, depending on how well the baby is, may have more patients than that. But that's going to be typically the first person that you're going to meet who will be able to give you an idea of how the safest way to interact with your baby, depending on their gestational age and what's going on with them. And then there are a lot of other people in the NICU too. There's doctors, there's nurse practitioners, respiratory therapists. As the babies get older, especially if they're there for longer stay, there's going to be physical therapy, occupational therapy, speech, dietitians, pharmacists. So if you're in the NICU, you might meet a lot of people all at once too. But everybody's there to really be on team baby first and get to know your brand new baby and help you get to know them as well.
So I think a lot of times people may be shocked to know that your nurse is taking care of other babies. Talk us through that because I think it can feel a little, maybe you're taken aback, being like, okay, well, I have this really sick baby. They clearly need to be in the NICU. Why do we not have one-to-one care? Which, for the record, you guys, your labor nurse is often not one to one with you either until you get into active labor. So just recognize that it is part of our healthcare system. This is a very normal and expected thing in the healthcare system. But I do want Mary to just explain, like, why do we have this? Because I do know that it can feel very discomforting or concerning once you hear, okay, well, my baby should be a priority. And just because your nurse has other patients, other babies, it doesn't mean your baby's not a priority. So that's what I want you to take away from this part.
Yeah, exactly. So how NICUs are designed tend to be really very team oriented. So I may have two patients, but if I'm in a space with other nurses, we basically all have each other's babies. So I'm going to be responding to other babies' alarms or parents' inquiries. But how the staffing ratios are in the NICU, it's just as you said, some of it is a hospital system and how it's designed, but I can very confidently and safely be able to care for a baby and a family's needs in within that kind of time frame of care. But that does mean that sometimes in the NICU you're going to encounter something called care times, which are when we go in usually every 3 to 4 hours and do assessments, vital signs, feeds, reposition, and then allow a lot of protected sleep time in between for the baby, whether that's skin to skin or bundled or in the isolette or whatever is appropriate for them at that moment and what works for the family. So you're going to be able to get when it is care time, that's when it's really that one-on-one devoted time to you and your baby and your family. And then the next time is really settling them in for that next period of rest and recovery and sleep, because that is what babies really need to heal, to grow, and to ultimately get out of the NICU, because the goal of the NICU admission is always to get the baby to home. But there is going to be moments where you don't have that one-on-one time with a nurse, but know that there are systems in place and we have a very great way to make sure that every baby is very safe, no matter what is going on, whether they're in the room with you or at the bedside or at another baby's bed spot. We are watching the full 12 hours of my shift. I have my eyes and ears on your baby, whether or not I'm next to you or not.
And your nurse is never more than like an arm's length away.
Literally.
Yeah.
Yeah. You're
You know,
never alone in the NICU, whether you want to be or not.
yeah, even if you want a little privacy, you're never alone. Which leads me to my next question, which is, you've got this overwhelm with we're dealing with the emotions that have come up from an unexpected experience and possibly even birth trauma that led us here. Now we've got all these new faces in the NICU that are caring for our baby. So, as a parent, how can I build a good relationship with my NICU team while I still feel like I'm advocating for my baby? Because it's very easy to slip into this place of, well, my NICU team knows best, so I need to stay quiet, which is great if you're comfortable there. I'm not saying speak up just to speak up, but what if I disagree with my NICU staff or I just have questions and no one's explaining it to me? How can parents navigate this while they're also working on little sleep? They've got a bunch of emotions. We possibly have birth trauma. I guess I'm looking for tips on what should we as parents be doing to reassure our staff, yes, I trust you, but I also want to be an active participant in my baby's care.
Right. So I think that the biggest barrier in the beginning is that the family doesn't feel confident in even what to ask or how to ask it because the NICU is so unfamiliar, right? You're like, I don't know what is, one of my like soapboxes is that we prepare so wholeheartedly for how to advocate for ourselves in birth, but we do not spend enough time being able to prepare and to advocate for ourselves in postpartum, whether the NICU is part of your story or not. But especially if the NICU is part of your story, like being able to understand just the bare minimum about the NICUs in your area and how they work and the dynamics, because that alone will set you in a place of feeling more confident in being able to step into that role of an advocate. There's two thoughts that I have there. One is always remembering that you know your baby best. They may have the medical experience that this baby and the expertise that your child needs in this moment to navigate this snapshot in time that they're going through, but you know your preferences, you know how your family, the dynamic that you want to establish, and you know that little baby was living in you for months, so you instinctively know your baby best. And so you are the only person also that can provide the nurturing care that your baby needs. So the medical team can provide medical care, but there's no replacement for the magic of having an involved parent, whether that is just literally it's just showing up. Another thing is like NICU families are like, I'm recovering physically, I'm emotionally, my hormones are all over the place. I'm trying to pump, I'm trying to do all these things. And now you're asking me, like, I don't feel like I'm doing enough for my baby, but just showing up, whether it's like for 5 minutes, it doesn't mean you have to be there 24/7 either. You can be an incredibly involved and supportive parent by respecting your own physical and emotional needs in that moment too. That's one piece of the puzzle. In terms of actually having conversations with the NICU team, I always go at it from a place of collaboration and curiosity. So you always or I like to engage in conversations from a place of, I would love to know more about how you got to that decision. Because especially in the NICU, because it's literally its own language sometimes. They're speaking in acronyms. There's all these other like backlights. You want to be able as a parent to make sure that you're being able to make an actually informed decision and advocate from a place of understanding for the unique needs of your unique baby. So just like we use brain in birth, brain in the NICU is incredibly important. So brain is benefits, right? Say something, a NICU professional is coming and saying, I think we need to start adding extra calories to the breast milk to help your baby grow. You can say, okay. Instead of saying, no, I don't, I absolutely do not want formula for my baby. You might want to know, why are they thinking this? What do I need to know to be able to make an informed decision using this new knowledge? So what are the benefits? You can ask them, okay, that's great. What are the benefits of this? And they'll shoot out a list. Are there any risks, right? Are there risks of adding this fortifier to this feed? Are there alternatives that we haven't thought about? I like to think of it two ways in the NICU is like, what does my gut say? So that's your intuition. Does my gut say my baby is ready for this change? Can I say maybe let's revisit this in a couple of days or whatever that means? And also information. So you can say, what other information do I need to know to be able to make this decision? And then N is what would we do if we did nothing, which is sometimes an option in the NICU too, not quite as often in a labor perspective because it is a little different advocating for yourself as an autonomous adult versus advocating for a child. The relationship it is slightly different because it's a different human's body in addition to your own. So you're having to get to know someone else's, the baby's needs and preferences too, because they're part of the picture in the NICU stay. But usually, if you are going into a conversation, assuming positive intent, right? Assuming the reason why the medical team is offering the suggestion or having this plan in place is in their mind, they are doing what is best for the baby in that moment. So if you go into the conversation assuming they're doing it from a place of good, whether or not it's what aligns, and you have the conversation with that leading the way, you're 9 times out of 10 going to have a beautiful collaborative conversation where the healthcare team is like, actually, you're right. Like, there are alternatives, or we can incorporate your preferences in this way. Or maybe you're going to listen to them and say, oh, I didn't understand the full benefits about why you were suggesting this. Now I do actually feel confident and comfortable with this next step. So it's all about, you're really taking a crash course in how to care for preemies and medically complex babies in those early days because it is something that, you have to learn in the moment, which can feel really, that part feels overwhelming. But parents that are going to be able to have those conversations will just feel better about their NICU journey too. My whole mission in the work that I do is to create more joy and less trauma in the NICU through empowered education. So that's really the foundation of the experience in the NICU and making it feel as joyful as possible.
Oh my gosh. And y'all, that's why I have her on the show. Okay, so Mary, you just hit on a good point that I think comes up a lot is when I'm in labor, I know I have the right to decline anything. I know it's my right to say no. I know that I don't have to listen to clinical suggestion if it doesn't feel aligned to me. Do we hold those same rights in the NICU when we're making decisions about our baby? My inclination is yes, you're the parent of this baby, you are their authority, you are or their authority, their authority figure, you are their guardian. Parent autonomy says yes. But what about babies who are medically complex and should you decline certain things, it may actually put your baby in harm's way or at risk for dangerous things down the line. Again, my inclination says that's a parent's right. Do you know anything about what the laws actually say?
I am not a lawyer. I did go
Yeah.
pre-law, right? My first degree before I went back to nursing school, I was pre-law. I wanted to be a lawyer. I wanted to be a juvenile justice court system judge. I watched a lot of Judging Amy, and that's what I wanted to do. But the laws, there are different state differences and overall things. So what I can speak to in my experiences is that there are sometimes moments in the NICU where there is a disconnect between where what the parents are thinking and what the medical team is thinking. Most of the time, it comes from lack of understanding from both sides. So the medical team does not fully understand the family's why, and the family doesn't fully understand the medical team's why. Most of the time, if once you have a conversation, often away from the bedside, so sometimes you have to step physically out of the beeping and the wires and the baby and have a conversation, most of the time people can come to a middle ground that feels good for everybody, feels safe and feels aligned. Occasionally, if there is a family that is adamant about something that the risks in the head of the medical team are higher than the benefits, so the brain ratio is out of alignment. Sometimes families will be able to sign a form that acknowledges that they were fully informed of the potential risks for the decision, that it is going against medical advice, right? That AMA statement, and that they're okay with that. So most of the time, if they're at that point, the form is signed, everyone acknowledges again, there's clear communication that this is the plan and everybody knows where everybody stands and it's still the decision that's made, then most of the time that's the case. Rarely, but it could happen, and this is only in incredibly rare instances. Occasionally, an ethics committee in the NICU or in the hospital will become involved. So it's almost like a third party mediator to be able to come up with a neutral plan of care, who someone who does not know the baby, that's just kind of stepping back and looking at the bigger picture. And it very rarely will like a third party person become involved, like CPS, to
Yeah.
become a mediator for that. But it is different. You can, as an adult, you have full autonomy over yourself and you can do whatever you want. But when a child's safety is at play, occasionally it is different than if it is just yourself. But most of the time, especially if it's under the understanding that the parent is fully informed about the decision that they're making, the parent is still the first line decision maker for a baby and family. That being said, the structure of the NICU, the culture of the NICU is a little bit different. There tends to still be this kind of hierarchy top-down approach where we do something and then we tell you about it, which is not the most ideal, but that is often how NICUs work. So if you want to really make sure that you're meeting decision makers in the moment of time that the decisions are happening, I always encourage families to be present for rounds. So rounds in the NICU typically happen every day. It usually happens in the morning-ish time. And that's when everybody's together in one spot, the nurse, the doctor, the parents, the all the other, specialty services or other therapists or providers in one space. So that's when the most ideal conversations are going to be happening. Because as we alluded to also in the beginning, nurses just have a few patients, but doctors and other people are taking care of sometimes 60 babies at a time. So they're not as available to have those deep conversations at any given moment during the day because they are also caring for other families and babies who are in similar crisis type scenarios. So making sure that your presence for rounds and understand and are there to advocate while the decisions are being made is where you're going to be able to feel the most confident and heard in those kind of moments in time.
And would you just ask what time do you guys do rounds and then make sure you get to the hospital maybe 15, 20, 30 minutes before that so you can kind of settle in and catch them if they're running early, spend extra time with your baby if they're running late, but definitely be present for those meetings?
Yeah, when I have a brand new family coming in as a bedside nurse, I usually give them a quick orientation both to the baby and to the day, that like the next 24 hours basically, like here's where it's coming. Families who are post-birth and in crisis they're not ready to learn really in the moment. So we're going to have to repeat things and make sure that we're meeting them where they're at in that moment. And every family is totally different. Some families want a play-by-play from the second that they're in, and other people are like, I just want to hold my baby's hand right now. I'm not ready to hear any of this information. And that's totally fine. People respond to their trauma event or the intensity of the event very differently, depending on their personality and their previous experiences and all the things that are going on in that moment physically with them too. But the best place is to say, I would love to be present during rounds. What time is rounds? Start with, I would like to be present. And if I cannot be present, I would like to have a phone call by 2 p.m. or whatever it is. Like, what is your expectation for follow-up to? The families, again, it all comes down to communication. So if a family feels, like nobody called me, wasn't at rounds, but the medical team does not know that is something that you prefer and you really want to do, then you're always going to feel like there's this missing piece. But if you're very clear with your expectations, you're allowing the medical team to theoretically meet your expectations. So just making sure that they're expressed thoughtfully, collaboratively, kindly, you're going to be able to integrate into the care team role much more effectively and thoughtfully, I guess.
Yeah, okay. I want to touch on the piece of you saying, what if you can't make it to round? So, if you've had a really tough C-section and maybe you're even having a really tough time healing, getting in and out of the car to and from the hospital, especially if you live further than 10 or 15 minutes on the road, can feel super daunting and it may not actually be the best for your body healing, right? There literally may be a decision of, I want desperately to go be at rounds with my baby. I want to hold my baby and see my baby physically, it
Mhm.
would be worse on my body healing if I were to put my body under this amount of pressure every single day for umpteen weeks and try and do that. Is there a way that, and maybe this is NICU specific, but is there a way that parents might be able to be videoed in or have that phone call where you can still be part of rounds, but you don't have to physically be there?
It is definitely going to be NICU specific. Some NICUs have better tech than others. There are some ways to video conference in. Some NICUs have cameras that are on the babies that you can watch like on an app on your phone. So even if you're at home and you're kind of watching and integrating in that way. Again, it comes about advocating for your preferences. That might not be the norm for the NICU. That might not be something the NICU's ever done before. But if you say, hey, I would love to have my sister-in-law can be here at rounds. I'm giving her permission to listen because, HIPAA, they have to have very clear, I would like to be dialed in on speakerphone for rounds and listen to it that way. The doctor might not be able to call them on their personal cell phone and batch them in, but if there's someone physically there that's like, mom's on speakerphone and would love to listen, that is usually able to do it. And some people have better tech that are HIPAA safe that will allow you to have those very open medical conversations on a tech platform. That's where like kind of the nuances come in because it is very clear medical exchange. So they have to be very thoughtful with how that HIPAA information is not able to be accessed by people who shouldn't have your baby's medical information and updates without your permission, especially too as a parent, which is something you would want as well, is to make sure that you're having the right people getting the right information. But the technology does vary NICU to NICU for sure.
Yeah, I can see that for sure. That is so cool that some NICUs have these cameras that you can tap into and just, it's like a baby monitor and you just
It
get to
is, yeah.
watch
Yeah,
your baby.
the other thing I wanted to touch on is that NICU families tend to have much higher rates of readmission after, like postpartum readmissions to hospitals for themselves because of the exact thing that you're saying. They are pushing their bodies way too hard. They feel like they need to be there. They cannot leave their baby's side. The amount of times that I've been with a family and they're like, I don't feel well, or they stand up and there's a bunch of blood in their chair. I don't worry about it. Families that have NICU births tend to forget that they gave birth because their brain goes right into hyperdrive of I need to focus on my baby and everything else is we'll figure that out later. So if you are someone who's supporting a NICU family, making sure that you are giving them ways to feel safe enough in their own baby's care and their care to be able to rest and heal and recover because going back into the hospital and being admitted is not what anybody wants for that family. But so often families will push themselves beyond their physical needs, and the body will tell you, the body will be like, no, girl, like you're doing too much right now. So it is definitely a really tricky balance to have postpartum. And that's a big piece that a lot of NICU families sometimes mourn is not being able to have that soft postpartum that they it envisioned having, 5 days in the bed, 5 days near the bed. That is not always part of the lived NICU experience. I do think that there's ways to recreate that and have families have a better postpartum experience, even if the NICU is part of their story, but it does take a little bit of planning and knowledge too.
So if there's anyone out there listening that's currently in the NICU and they're in that space where they're like, I desperately want to be with my baby, but I do definitely recognize I might be pushing my body too hard and they're having guilt and shame and all these big feelings come up, what do you have to say to them?
Yeah, one of my other favorite phrases is that the NICU is only the beginning. It is chapter one. So, how you show up for your baby in these first days or weeks is important, but how you show up for yourself is equally as important. And you have thousands of more nights together as a parent to bond and connect and advocate and do all the beautiful things that are parenting. This is a snapshot in time, and you are the best parent for your baby, and you're doing the best that you can in the situation that you are in. And your baby is so lucky to have you in whatever capacity that is for you right now. Like your baby is giving you so much grace, so give yourself the same as well.
I love that. Oh my gosh, I could just cry hearing you say that. Okay, my next question is about we're there in the NICU, we're sitting and trying to bond with our baby, but they have all these cords on them and there's all these things around us and they have got just a bunch of stuff on
Mhm.
them, right? Feels really intimidating, looks really intimidating, actually is kind of intimidating. How do I, as a parent, go about bonding with my baby, facilitating that kangaroo care, that skin to skin, when my baby has all of these things on them? How are we doing that? Because it looks really different than traditional skin to skin of a baby that has nothing on them.
Right. And it is logistically different, but the benefits and the overall experience also always comes down to empowered education. So once you know on your baby's skin which wires are the important wires, which ones are okay if they come off for a second, and that comes from practice. So if most of the time during care times, the nurse should say, even for the tiniest little babies, I would love to teach you how to change this baby's diaper through the holes of an isolette. What's the safest way to move a tiny baby's hips? What type of, different wipes or maybe creams they're using? And slowly build your confidence muscles every single care time. So the beauty of care times, whether they're relentless, but they happen every 3 to 4 hours. So every 3 to 4 hours, you have a chance to learn a little bit more, get a little bit more confident in the hands-on kind of tasks that are parenting, because those still, even for the tiny critically ill babies, that still exists. So diapering, repositioning, oral care, connecting. So getting confident in those tasks are something that is usually happening in the first hours to days after a baby is born. In terms of bonding, there are so many magical things that a family can do. And again, I can change a baby's diaper, but I do not, as a nurse, but I do not have the same magic of connection that family has with the baby. And that is really where, there's like the science of medicine and healing in the NICU, and then there's the art and the magic of it. And the best part about being a NICU nurse is you get to experience both. But the families are the keepers of that magic. So building up remembering in your head that you are still the special medicine that only you can give for your baby. Some babies in the beginning, for a variety of reasons, depending on how critically ill they are, whether they had surgery, whether they're super, super premature, they may not be able to have skin to skin in the first days after birth, but there are still ways to connect with your baby. That can look like what's called a hand hug, which skin to skin is the gold standard, is being on your baby's chest and connecting with them. You have the heartbeat, it's connected. But especially tiny babies, if you're skin to skin, if you're doing a hand hug with the same intention, love, and connection that you would be doing skin to skin, they're going to have a very similar physiologic experience because it is skin to skin. Like a gloved hand is not the same, but having that connection. So babies that are born early, especially, they are really craving boundaries and being able, if you're being kicked in the bladder, as you probably are right now, the baby's going to stretch out and they're going to feel the pressure of the uterus and pull back in. Babies that are born prematurely are craving being reconnected back in. They're like, where am I in space? Just holding your hands in a very safe, containing position. If you Google hand hug, you'll see it, is incredibly grounding and reassuring for a baby. Plus, they know your smell. Smell is one of the first senses to develop in utero. Scent hearts, which seem so simple, but the evidence behind it is really strong. So that's just a small heart or any shape. You can do whatever feels right to you. One goes on the parent's chest and the other goes with the baby, and then they go back and forth. So having something near the baby's face that they can smell and connect with. And then there's sound too. So babies are their auditory processing is also very early developed, even for those tiny babies. They may not be able to tolerate direct sound. They might need a little bit of a boundary between your voice, but you're just going to be learning your baby's cues. What do they like? What do they not like? Do they like to lay on this side? Do they not? And then there's the magic of actual skin to skin. The evidence in the NICU is so strong to support growth, development, decreased infections, maternal bonding, maternal blood supply. Skin to skin is pure magic, but there are logistical differences in the NICU. It still has to be right in that brain. We need to make sure that the benefits and the risks are equal, or that the benefits are that much higher. So babies have a lot of wires and tubes and things. Some of them are life-sustaining, right? If they have a breathing tube in, we need to make sure the breathing tube is safe while they're feeding, while they're being held skin to skin. So it takes a team and it takes a lot of open communication, but it is incredibly important. So sometimes families are really intimidated and are like, no, just leave them in the isolate. I don't want to hurt them. But remembering that only you have this gift to be able to help them in that moment. And if you can't skin to skin physically for whatever reason in the early days, that's okay too. They're going to feel it, they're going to connect. You're not doing anything wrong, you're not setting them up for not success in the long run. It's meeting yourself in that exact moment and meeting your baby's needs in the way that you can in that moment too. But skin to skin in the NICU typically looks like you have a lot of people around you. Ideally, you're set up, you pumped, you peed, you changed your pad, you did all the things. And then we try to get babies out for at least an hour and ideally up to 2, 3, as long as you're comfortable and the baby's comfortable too. So it is a production, but the magic that I've seen through with skin to skin in the NICU, the stories are just so powerful. Like I'm just can preach no more about skin to skin. It is pure magic.
I feel like we could have a whole episode just on skin to skin and the benefits of it for both you and baby, right? Okay, I guess a lot of people probably have this fear of, well, how do I know if my baby is safe? And like, how do I know if my baby is comfortable? So when it comes to a NICU baby, are we looking for kind of the same signs as we are term babies that didn't have a NICU stay? Or what are some of the things that we're looking for as parents to say, oh, I should hit that call button, or I'm not sure that my baby is comfortable, or I'm wondering if my baby actually does need a break and we should put them back in the isolette. I should call the nurse back in to ask.
Yeah, so the interesting thing about being in the NICU is that you have this extra set of almost like a language that the baby can share that you don't have in the real world, which is their vital signs. So they're on a monitor, and your nurses will be able to help coach you on what normal baby vital signs are and what vital signs are that they have when they are in distress or uncomfortable. So it depends on each baby. But one thing also while we're talking through this is that remembering, especially for preemies, their brains are still developing. So what touch feels like to them as a term baby feels very different for a preemie. So our instinct when we see something cute, like a baby or a dog or a puppy or whatever, we want to stroke it. But preemies, their skin is not designed to be stroked in that way. It is that actually they've watched babies' vital signs with stroking and it can feel uncomfortable to them. So what they really prefer is firm, contained touch. So the hand hug, they still love, they're always playing with their umbilical cord in utero, so they love to hold onto a finger or grip onto something. Having like really holding them back in that fetal position so you'll see their body literally just relax. Okay, I'm safe, I'm home, I'm with my person, and I'm in the position that I feel comfortable with. But similar, it will be similar to a baby that is term. They might start to squirm or cry out. Some babies are being held skin to skin. They might have breathing tubes in. You might not be able to hear them cry, but parents' instincts are right. If you are feeling like my baby is uncomfortable, they're showing me that they need something different, speak up. And most of the time, there's something we can do that will help them be more comfortable. The tricky part of the NICU is that there are pieces of the NICU experience that we do to babies to keep them safe and sometimes to keep them well are uncomfortable by definition. So then on the flip side, we need to figure out how can we balance out those uncomfortable experiences with comfortable positive ones, or what can we do during those different types of uncomfortable procedures or things to help keep them the most comfortable in that moment too. And there's a whole toolkit of things that parents can do and healthcare professionals can do too.
Like what?
Well, one of the most important ones that sometimes families need to reframe in the NICU is the power of suck. So what a baby has that is their most powerful toolkit in their own toolbox for making themselves feel good and safe is to suck on something. So with a baby that's born prematurely or critically ill or in respiratory distress, they're not always going to be able to eat and suck. So they might not be able to safely take a breastfeed or a bottle feed, or they might be too premature to be able to coordinate their suck, swallow, breathe, but they still really crave the soothing of sucking. So in the NICU, the pacifier becomes a powerful tool. It's not like a plug we're putting in to be like, shh. It is such an incredible but simple way for a baby to comfort themselves. And also, especially for those babies that are having gaps in their feed, they're strengthening their oral muscles. They're figuring out their tongue placement. Especially if a baby is being tube fed, which a lot of preemies are in the beginning, they're learning that sucking on something means a full belly. So it is just, it's more than just, I know in a term baby, you might be like, okay, I don't want pacifiers in the beginning because I don't want it to interact with breastfeeding, which that's one lens of going down of like how to interact with a pacifier as a parent. But with the NICU, it is a different experience. It is a powerful thing that we have that is, there's very low risk to, sucking on a pacifier, but being able to give them something that they can have and soothe themselves in those moments is a simple solution to a potentially uncomfortable experience.
Yeah, okay, you touched on a really important and stressful topic, which is feeding.
Mm.
Because so many times we get in the NICU and we see our feeding goals just go completely out of the window, and it's not possible to breastfeed our baby, even though we desperately want to. And that was really our only plan. We're super committed to it, we're super dedicated to it. So, talk us through the options that we have for families who want to prioritize breastfeeding, but their baby isn't quite there developmentally. What else can we do instead?
If breastfeeding is part of your goal and what you want for your family's journey, the most important thing you can do in the first day is basically pumping as if the baby were with you. So in order to establish a milk supply, so when the baby is well enough or big enough or strong enough to actually go to breast, you have a protected milk supply to be able to offer to them because that falls through the cracks all the time with NICU families. Again, they forgot they gave birth, they're going to see the baby, and they don't realize that no one's told them that they have to pump in order to be able to establish breast milk supply because those early days and that supply and demand is really what lays the foundation for the breast tissue to form the appropriate ducts to be able to then lactate and continue on that journey. Doesn't mean it can never be reestablished, but it makes it so that you're still following along with your baby at the same time. So ideally, if you can pump in the first hour after delivery and then continue pumping every 2 to 3 hours to be able, even if you're getting just drops, there's two amazing benefits there. One, that colostrum can still be fed to your baby, whether or not they can have it directly sucked from a bottle. A lot of times, especially with preemies, we'll do oral care with colostrum. So you put a little bit on whatever the was pumped and you put it on the cheeks. And so it helps to positively colonize the upper part of the GI system, even if they're not able to digest food yet for whatever reason, or they're being tube fed because they don't have the capacity to suck and swallow for whatever reason. And then being able to keep up with that as much as possible. That being said, also, if you are a preemie parent, know that your body knows that you had a preemie and it will produce milk accordingly. So preemie milk is different than term milk, which is so cool. It has higher protein, it has lower lactase, so it has those good things that help the baby grow. It has less lactase, so it's easier for the baby to digest. It literally looks different. It's super thick, and it knows that the baby's smaller. So sometimes the volumes are smaller in the beginning and then grow as the baby continues to grow and develop. So it's pretty magical to watch. But also know that it is different and you're allowed to feel sad about that. Like that there might be a moment of grief or anger or frustration that like this is not when I took that breastfeeding class, this isn't what I had in mind. I did not want to pump around the clock. I didn't want to not feed my baby by breast. So know that it is possible, but it will look different. It can look different, and different is okay. It's okay to be sad that you're doing something differently, but it doesn't mean that breastfeeding, even exclusive breastfeeding down the road is not attainable. It just is going to be a journey, just like the baby's going on a journey throughout the NICU, your breastfeeding journey will kind of follow along with it. If in the beginning, say you have a baby that is able to take, they want to, there's so many different scenarios, but they want to offer some type of feed to your baby, but you maybe don't have a full supply of breast milk yet, or you're just getting drops because of colostrum. Most NICUs do have access to donor milk. The AAP's guidelines are that all babies born before 28 weeks are fed exclusive breast milk, whether the family can produce or prefers to produce breast milk or through donor milk. So donor milk, most NICUs have access to a pasteurized breast milk through a donor, like a milk bank that they're having access to, and most babies in the NICU will qualify, even if it's as a bridge. And this is, every NICU is going to have different resources and access to this is an option, but I would always say and ask if it's not being offered, do you have donor milk? Can we use it as a bridge if this is a preference too? So there are lots of options, but it is a different experience. But really, those early pumping, prioritizing pumping in the early days, even if you think the baby's going to be in the NICU for 4 hours, start pumping. Act as if the baby is skin to skin with you and start expressing milk. And if you're someone again supporting a NICU family, this is something that you can help remind them. Is this something that you're able to do right now? I know this is the why behind why we're doing this early pumping experiences.
Now, is there a situation or scenario where your NICU staff may discourage you or tell you that you're not allowed to pump and bring in breast milk?
Again, every NICU is going to be different, but I can think of like on a one hand, like one or two scenarios where it might not be safe to feed that baby's that breast milk, but it typically would be something, some type of substance or medication or drug exposure that would not be safe for the baby to have, especially if it's a very premature infant. Their GI systems are not designed to be turned on, but we have to turn them on because they're born. So we want to be really cautious and thoughtful about what type of milk we're feeding, but it is extremely rare. And most of the time, the parent would have already been kind of counseled if they're taking a medication or something on the fact that their breast milk might not be safe, especially in the beginning. But sometimes families are, they're able to pump for a few days or weeks, and then whenever the medication or whatever they're exposed to is out of the system, then they still have a milk supply and then can start offering the baby. But I would say that shouldn't be the case for most families in normal scenarios or non-unique scenarios.
And if you run into that, just be communicative and be very,
Yeah, I would be very, again, curious in collaboration. Why is it that you're saying that we should not be feeding breast milk right now? What about, say, they're offering a formula? What specifically about this formula does my baby need right now? I need to know more information to be able to have this understanding. The tricky spot that this could come up is with the baby with low blood sugar and making sure that they're getting a feed in to be able to maybe avoid getting an IV. But in that scenario, ideally breast milk should still be offered first if that is what the family is able to pump, and then having an option like donor milk as a bridge. And then if that's not available, having a discussion about what would be the next safest way to make sure that my baby's blood sugar is maintained, whether that's through formula or an IV or whatever that is in that moment. But again, those conversations, curiosity and collaboration are going to make you feel as heard as possible. And if you're not feeling heard by a person, ask to speak to somebody else. Say, thank you, I respect your opinion. I always do my due diligence and make sure I have heard from all the people, all the players in this conversation. Who else can I speak to?
mm,
And if it's a resident that you're talking to, they might get their attending. If it's a bedside nurse you're talking to, they might get their charge nurse. There's always the hospital, for better for worse, is a hierarchy. So there's always someone that you can turn to ask above. And really, most of the time, again, it comes to understanding the why. Why are we making this choice? And then the healthcare team needs to understand, why does the family feel so strongly about not making that choice? And then how can we make sure that, again, team baby is always needs the priority, making sure that everybody leaves their strong ego sometimes at the bedside and goes into it from a place of understanding like what is best for this family and the baby at the end of the day. What is going to be get this baby through whatever hurdle they're going through and safely home
yeah.
where the family can do whatever they want.
And thrive. Yeah, go home and thrive because the worst thing that you can have is a readmission. And that's what we really ultimately want to prevent is that once your baby leaves the NICU, you guys are kind of footloose and fancy free. You might have some accommodations to make at home. Life might be a little different than what you had originally envisioned, but hopefully once you're discharged, you can stay at home and you don't have to be readmitted with your baby because that carries its own type of trauma. So, Mary, we've done a really good job of kind of like pointing out different situations of things that you might encounter and options that you have. You have a birth plan template specifically for planning for the NICU for either parents who know the NICU is going to be part of their story prenatally or just parents like me who like to think about all the things and just have a plan for it. But much like your birth plan, this is a flexible plan. It's more like a preparation rather than a this is what we are going to do, this is what is going to happen. It's more we have thought about these options and here are our preferences. We can be flexible with them later if need be. Tell us about that and some of the things that as you're thinking about your birth plan, planning for the NICU, whether you know or you don't know it's going to be part of your story, what are some of the things that you may want to include on there and where can people get your template?
Yeah, so I created the birth plan template because I was seeing so many times families come to me as a NICU nurse and feeling so overwhelmed and out of control by the scenario and knowing they there were so many things that I got frustrated me like you if only you knew these few simple things this would still feel intense. There's no amount of planning that can make the NICU not suck, right? Like it's still you're still going through a really hard experience. It can make it better, but by having no information, you're feeling so out of control and overwhelmed. Some of the things that are on this template, again, in the conversations that I have, I always say, like, I also am a trained birth doula in addition to being a NICU nurse and NICU doula and all the things. But with my own clients, I'll say, this is my fire drill model. I have a kindergartner. She goes to kindergarten and does fire drills. It doesn't mean that she's manifesting a fire. It doesn't mean that now she's morbidly afraid of fires and all she thinks about is fires. It means that if there is a fire, she has a plan in place and people know what to do and they can feel safe. So that is how I broach this kind of NICU topic and encourage, even if you don't think the NICU is going to be part of your stay, to do it from a place of informed decision making and empowered parenting, not from fear or from overwhelm. You think about it, you wrap it up in a box, and you put it away. But in terms of NICU planning specifically, one of the most important things and that people don't realize is that not all NICUs are the same. There are 4 levels of care in the NICU in the United States. So there's level 1, 2, 3, and 4. So even if you're delivering in a hospital and you saw online, they say they have a NICU, you really need to know what level of NICU care do they have. So a level 1 NICU, and this is similar to if you're listening to this in other countries, but this is specific to the United States. Level 1 is otherwise known as a well baby nursery. So these are labor and deliveries that can resuscitate a newborn, but they cannot continue to care for them regardless of if they need any type of additional support, they can't stay and get the quality care that they need or have the individualized care or even the resources and technology to support them. Level 2 NICUs are also known as a like special care nursery. So typically level 2 NICUs can take care of babies that are 34 weeks and above that just need help, what we call in the NICU feeder growers. So they need help learning how to eat, maybe how to stay warm, they need to grow a little bit, and then they're ready to go home. But they don't need respiratory support, specialized care, anything like that. So if your baby is born at a level 2 NICU, less than 34 weeks, or needing additional support, they will need to be transferred to a different healthcare facility. And so that might look like it's a hospital across town. It could be hours away. It could be in a different state. So knowing where the different NICUs are in your area and what their levels of care are can help you make informed decisions as well. So if your water does break and you're 32 weeks and you were planning on delivering at this hospital because this is where your OB is, but they only have a level 2 NICU, maybe you're better off going across town and hitting the NICU that is level 3 or level 4 because you're not going to have that time of literal separation from your baby while you're recovering from your birth. The level 3 NICU is like a more of a generic NICU. When people think in NICUs, it's usually a level 3. So they can take care of most babies down to the itty bitties up to term infants. They can do respiratory support, intervention. But the big difference between a level 3 and a level 4 is a level 4 has all the specialists that the baby might need that are pediatric specialists in-house. So if they need a pediatric cardiologist, they're there. Pediatric endocrinologist, they're there. If they need surgery in the middle of the night, there's someone there 24/7. So they tend to be associated with children's hospitals or teaching hospitals. So there are some states that have one level 4 NICU or none, or they might have to go across to a different area. So depending on what type of support your baby might need, they still might need to be kind of transferred around. So at a bare minimum, just knowing, it's a Google search, what are the level 3 NICUs in my town? What type of facility does where I'm delivering at? And if you're giving birth at a birthing center at home, where would you prefer, if there is a NICU stay, to go? because all NICUs have a different kind of flavor and culture and skill set. So just having that general idea. I was the cuckoo NICU nurse that when I was pregnant, we went on a road trip like 8 hours up. I knew where all the level 4 NICUs were the whole way up 95 North. Like I knew where they were. And my husband did too. And he's, you are insane. I was like, I'm 24 weeks driving on this road. Like, I don't want to wing it. So I was fine. But you don't necessarily have to go down that road. But it is helpful just to know in your area. And then also, if the NICU was part of your story, what do you want it to look like? So, do you want to go? Do you want to have your partner go with the baby? Do you want your partner to stay with you? Do you have a way that you prefer to be updated, making sure that the NICU team knows your preferences for communication? The other thing that often gets missed is if you, especially for a term baby that's going to the NICU in those first kind of immediate after birth and beyond, if you have preferences that say around erythromycin or other types of things that are routine baby care in a hospital setting, those are not always communicated to the NICU. So making sure that is clear so that you're not that there's no missing communication there, that something isn't administered without an understanding from you. So that's something that is easily communicated. It just needs to probably be done with more intent too. And then also having a plan for your feeding preferences as well and connection. So if you can't be there, are you okay with other people holding your baby skin to skin? Again, what are your feeding preferences? Are you already like blanket assenting to donor milk? Because most NICUs will still have to have you either consent or assent. So you can almost do that beforehand and be like, if I can't breastfeed, I already say yes. Like it's already there if that's something that feels aligned to you. So those are just some simple things to start with. The birth plan also has some other more detailed, like kind of different scenarios that you might want to think through. But a good place to start is just an understanding of where the NICUs are and do I have preferences about what NICU I go to, if that is a choice that I am able to make in that moment.
Yeah. Oh my gosh, this is so powerful. Okay, my last question is, what other resources are available to NICU parents, like support groups, counseling? I mean, we can always seek out our own mental health counselor, but is there something that NICUs will provide, educational materials that the NICU staff will provide? What do parents need to know to ask about if these things aren't being necessarily offered up?
Yeah, one place to start there is you mentioned like mental health resources. The statistics for NICU families, the NICU is intense. So the rate of postpartum depression and anxiety, OCD, and even PTSD is much, much higher for NICU families than non-NICU families. So if you don't already have a plan in place for how to support your postpartum mental health, which I feel like everybody should, no matter what's going on, because being a new parent is a mind game. And if you don't already, making sure that you know that this is a possibility for your path, that it does change the likelihood of you experiencing perinatal mental health concerns. So there are a lot of resources. Some NICUs do this better than others. Some have in-house type of therapists or support groups or counselors, depending on how big the NICU is or what the resources are. If not, there are a ton of amazing nonprofits out there. There's Project NICU, Hand to Hold, Dear NICU Mama, March of Dimes, that have support groups and resources, and that's just a handful of them. There are so many amazing ones out there. And then sometimes it's just finding that peer support too. So it's so helpful to have someone who's walked this story with you or has walked the story before that can help you navigate it because no one really understands the NICU unless you've been in the NICU, the unique feelings and experiences and just nuances. And even taking the baby home, life after NICU does not mean that the NICU is just done and it's all sunshine and rainbows. The babies often, you already saw your baby go through this, so it just changes the lens on how you step into your role of a parent at home too. But there are, if you're not feeling confident in your on your understanding and your resources and in your education, ask one of the best resources in the NICU is a social worker. So each NICU should have a NICU specific social worker whose job it is to connect families with resources that are specific to their baby's unique needs. Because if you've met one NICU baby, you've met one NICU baby. They're all going to have different stories and timelines and diagnoses. So having them kind of be your point person can be very helpful. But I'm also available as the NICU translator to help families connect with empowered education and with each other to be able to support and figure out how they're going to get through this and feel as good as they can doing it.
Oh my gosh, Mary, you are so brilliant. You have such a heart of gold. And I think I'm so drawn to you because you genuinely care about uplifting these parents to make sure that they stay in the know. They know their options. They understand what is happening on this experience, regardless of whether it was expected or unexpected. And, that's the whole name of the game here in this community is just to elevate parents and make sure that they are really the decision makers in their journey because we know that in and of itself prevents so much trauma. So I love you so much. I thank you so deeply for being here with us today. And you guys, we will actually see Mary in the next episode too, but it's going to be for doulas who are supporting people in the NICU. So stay tuned for that. Mary, if people wanted to connect with you, learn from you, grab some of your courses, if they are a NICU family looking for more support, how can they do that and what kind of resources do you have for them?
Sure. So I am on Instagram as the NICU Translator, so you can always shoot me a DM and connect there. I also have a podcast called the NICU Translated, where it's a combination of short informational episodes about different NICU topics, because I know in the moment you just want to learn in bite-sized pieces, and information from experts and other resources to be able to have better understanding of the NICU. And then I also work as a virtual NICU doula. So I work one-on-one with clients. I work specifically during the transition from the NICU to home because parents go from 24/7 nursing care and on a monitor to be like, oh gosh, my baby's at home. Now what? So I both serve as a NICU doula and I also train other professionals to become a certified NICU doula and be able to help families feel more supported emotionally and physically and logistically from the moment that they find out the NICU is part of their journey throughout the NICU and during that journey home as well. All my information is on my website, thenicutranslator.com. You can find the birth plan template there. I have a blog and my podcast, all right there.
I love it. Oh my gosh. You guys, I know that the NICU is an intense time, and I know it is something that often can feel like a really unexpected thing in your journey. And a lot of times it does add a lot of extra layers to growing your family. But I always want to aim to give you extra resources and experts to turn to and to remind you that no matter how hard things are, you are not alone. And I hope this episode not only set you up for what you can expect in the NICU, but it gave you really tangible steps and action items and options and education of what you actually are controlling, what you can be in control of if you find yourself in the NICU. I also want to always empower you to have that collaborative care. We know that really open communication style, trusting your care team while also feeling empowered to speak up when you feel so inclined is so important to not only helping you feel like an advocate and an active participant in your baby's care, but also improving outcomes for you and your baby. All right, you guys, I will see you in the next episode. Be sure to follow Mary on social media. And you can find me at Tranquility by Hee and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm Hee, and this is the Birth Lounge Podcast.